Your feet are talking to you every single day. The question is whether you are listening. Let me say that again in a slightly different way. Your feet are sending you messages constantly. Some of those messages are simple, some of them are urgent, and a few of them are quietly telling you something that has nothing to do with your shoes, your age, or how many miles you walked this week. I am Dr. Narges, and this is HealthWise. Here's what I want you to understand by the end of our time together today. There is a very common belief that most foot problems in adults over 40 are simply part of getting older. Hard skin, numbness here and there, a slow healing blister, dry cracks that never seem to fully go away. We tell ourselves that this is just what happens when you have been on your feet for decades. We tell ourselves that it is probably the shoes, or maybe that we are just not as young as we used to be. But here is what surprises most people. Some of the most common foot changes that adults ignore are not normal aging at all. They are early warning signals from a completely different system in your body, your metabolic system, specifically your blood sugar. And this is where the insight gets truly important, because most people associate diabetes symptoms with things like thirst, frequent urination, fatigue, or blurry vision. And those things can happen. But here is what the medical literature and decades of clinical observation have shown. For a very large number of people, the very first clues appear much farther from the center of the body. They appear at the very ends, in your feet. So when we talk about 9 warning signs in your feet that could mean diabetes, I do not want you to hear that as a scary list. I want you to hear it as something much more useful, a map. A set of quiet signals your body has been sending you that you might have learned to ignore simply because no one ever told you what to look for. Think about that for a moment. How many small changes in your feet have you noticed over the past year or two that you simply dismissed? A spot of numbness when you first wake up. A callus that seems thicker than it used to be. A small cut that took twice as long to heal as you expected. A strange burning sensation in your toes at night that you chalked up to being tired. None of these things on their own means you have diabetes. That is not what I am saying. But each of them is worth understanding, because each of them is a piece of data your body is offering you. And here is the deeper truth that changes how you should think about this entire topic. By the time most people are diagnosed with type 2 diabetes, they have already had elevated blood sugar for years. Sometimes 5 years, sometimes as many as 10 years. That is not an exaggeration. That is the medical reality. The disease does not appear overnight. It builds quietly in the background while you go about your life. And during those years, while your blood sugar is slowly rising, your body is not silent. It is signaling. It is trying to get your attention. But the signals are subtle. They are easy to misinterpret. And unless someone teaches you what to notice, you will almost certainly miss them. Your feet, more than almost any other part of your body, are exquisitely sensitive to changes in blood sugar. The nerves there are the longest in your body. The blood vessels there are the farthest from your heart, and that distance matters. When something begins to go wrong metabolically, the ends of the line feel it first. Just like the tips of a tree branch show damage before the trunk does. Your feet are the tips of your branches. So what I want to do with you today is walk through 9 specific warning signs. Not to scare you, not to diagnose you, but to give you a framework. A way of looking at your own feet that you probably have never been taught. Because here is something most doctors do not have time to tell you in a 15-minute appointment. Your feet are not just feet. They are diagnostic windows into your metabolic health. And learning to read them is one of the most practical preventive skills you can develop after the age of 40. Let me give you a small example of what I mean before we go any further. Consider numbness. Almost everyone over 50 has experienced some strange sensation in their feet at some point. A pins and needles feeling, a spot that feels like it is asleep, a patch of skin that does not seem to register touch the same way it used to. Most people assume this is either poor circulation or just getting older. But here's what actually happens. High blood sugar damages the small blood vessels that feed your nerves. When those nerves do not get enough oxygen and nutrients, they begin to malfunction. And the first place that malfunction shows up is in the longest nerves in your body, the ones that run all the way from your spine down to your toes. That is called diabetic peripheral neuropathy. But do not let the complicated name distract you. The simple version is this: your feet lose sensation because your blood sugar has been quietly high for a long time. And by the time you notice the numbness, that nerve damage has already been happening for years. That is the kind of insight I want you to walk away with today. Not fear, awareness. Because here is the empowering part. Once you know what to look for, you can do something about it. You can have a conversation with your doctor. You can ask for a simple blood test called hemoglobin A1C that measures your average blood sugar over the past 3 months. And you can make changes to your eating and movement patterns that lower your risk significantly. But none of that happens if you do not know what your feet are telling you. So take a breath with me. This is not meant to be heavy. It is meant to be clarifying. Over the next several minutes, I am going to show you 9 specific signs. Some of them you have probably heard of before. Others will likely surprise you. But by the time we finish, you will have a completely different relationship with your feet. You will stop seeing them as just the things that carry you through your day, and you will start seeing them as the early warning system they were always meant to be. Let us begin with the first sign. And it is one that almost everyone misses because it feels so ordinary. Let us talk about the first warning sign. And I want to be very clear about something before we go any further. What I am about to describe is something that most people over the age of 40 have experienced at least once. Many people experience it regularly, and almost no one thinks it has anything to do with their blood sugar. The first warning sign is a persistent feeling of pins and needles in your feet. That tingling sensation that feels like your foot has fallen asleep, except it never quite wakes up all the way. Maybe you notice it most at night when you are lying in bed. Maybe you feel it after you have been sitting for a while. Or maybe it is just there, in the background, a low-grade fizziness in your toes that you have learned to tune out. Here is what most people believe about that sensation. They believe it is from sitting wrong, or from crossing their legs, or from poor circulation, or simply from getting older, and all of those things can cause tingling from time to time. But here's what your doctor is thinking when you mention this symptom and you also have other risk factors like a family history of diabetes, or a waist size that has slowly increased over the years, or blood pressure that has crept up. Your doctor is thinking about something called peripheral neuropathy. Let me explain what that actually means in the body. Nerves are like electrical wires. They carry signals from your feet up to your brain, and from your brain back down to your feet. For those signals to travel properly, the nerves need a steady supply of oxygen and nutrients delivered through tiny blood vessels called vasa nervorum. When your blood sugar is consistently elevated, those tiny blood vessels become damaged. They narrow, they become less flexible, and they stop delivering what the nerves need. The nerves begin to malfunction. And the way a malfunctioning nerve feels is exactly like pins and needles, or burning, or numbness, or a strange coldness in a foot that is actually warm to the touch. Here's the part that most people do not understand. This damage does not happen overnight. It happens over years, and it is almost always completely silent in the beginning. You do not wake up one day with full-blown neuropathy. You wake up one day with a slight odd feeling in your big toe. Then a few months later, you notice your feet feel a little different in your shoes. Then a few months after that, you realize you cannot feel the floor quite as well as you used to. The progression is so slow that your brain adapts to it. Your brain literally recalibrates what normal feels like. So by the time you actually notice something is wrong, the damage has already been happening for a very long time. That brings us to the second warning sign, and this one is even more commonly ignored: numbness. Not the kind of numbness that comes and goes, but a persistent dulling of sensation in specific areas of your feet. Maybe you notice that you cannot feel the texture of your carpet anymore, or that you have stopped noticing when your socks are bunched up inside your shoes, or that you burned your foot on a hot pavement and did not realize it until someone pointed it out. Numbness is the direct result of nerve damage progressing past the tingling stage. First, the nerves become irritable, which causes the pins and needles. Then they begin to lose function, which causes the numbness. And here is the dangerous irony. The numbness itself is not painful. It is the absence of feeling. And because it does not hurt, people rarely mention it to their doctor. They think, well, it does not bother me. It is just a little numbness. But that numbness is actually more concerning than pain in many ways. Because pain gets your attention. Pain makes you do something. Numbness just quietly allows damage to happen without you knowing it. The third warning sign is a burning sensation. This one is different from tingling and different from numbness. Patients describe it as a low-grade burn, like the feeling of walking on hot sand, or like the soles of their feet are sunburned, even though they have not been in the sun. This burning often gets worse at night, and it can be severe enough to disturb sleep. The medical term for this is dysesthesia, which simply means abnormal sensation. But what is actually happening is that damaged nerves are sending faulty signals to your brain. They are reporting heat when there is no heat. They are reporting pain when there is no injury. Your brain receives these signals and interprets them as burning, because that is the closest match it has in its catalog of sensations. Now let me pause here because I want to address something important. All three of these sensations can have causes other than diabetes. Vitamin B12 deficiency can cause tingling and numbness. Thyroid disorders can cause nerve symptoms. Alcohol use can cause a specific type of nerve damage. Even something as simple as wearing shoes that are too tight can compress nerves and create similar feelings. So please do not hear what I am saying as a guarantee that any foot tingling means diabetes. That is not the message. The message is that these symptoms deserve attention. They deserve an explanation. And in a very large number of adults, the explanation turns out to be elevated blood sugar that has gone undiagnosed for years. The fourth warning sign is something you can see with your own eyes: changes in the skin on your feet. Specifically, skin that becomes dry, cracked, or scaly in ways that are not explained by weather or bathing habits. High blood sugar damages the small blood vessels that supply your sweat glands and oil glands. When those glands do not function properly, your skin loses its natural moisture and flexibility. The skin on your feet becomes dry. Then it cracks. And those cracks, especially around the heels, can become deep enough to bleed. Those cracks are not just uncomfortable. They are openings. Openings in your skin where bacteria can enter. And here is the part that makes this truly dangerous. If you also have some degree of numbness from the nerve damage we just discussed, you might not even feel those cracks forming. You might not notice a small infection starting. And because high blood sugar also impairs your immune system and slows wound healing, that small infection can become a serious problem much faster than you would expect. The fifth warning sign is closely related: calluses that form in unusual places or that seem thicker than they should be. When you have nerve damage in your feet, you change the way you walk without realizing it. Your gait shifts subtly to avoid pressure on areas that feel strange or uncomfortable. Those changes in your walking pattern create new pressure points, and your skin responds to those pressure points by building thicker, tougher layers. So you develop calluses in places you never had them before: on the balls of your feet, on the sides of your toes, on your heels in a different spot than your old calluses used to be. These calluses are not just cosmetic. They can break down underneath the surface, creating something called an ulceration. An ulcer is a deep sore that forms under a callus. You cannot see it from the outside. You cannot feel it because of the numbness, but it is there, and it is slowly getting worse. Let me tell you why this pattern matters so much. In a healthy person with normal blood sugar and normal nerve function, a small cut or blister heals quickly. The immune system responds. Blood flow brings oxygen and healing cells to the area. New skin forms. The whole process takes days. In a person with undiagnosed or poorly controlled diabetes, that same small cut can take weeks to heal, or it might not heal at all without medical intervention. And because the person cannot feel the cut, they do not even know it is there. They go about their daily life. They walk on that foot. They put pressure on that wound, and the wound gets larger and deeper. This is how people with diabetes end up with foot infections that require hospitalization. This is how a small blister can lead to a bone infection. And in the most serious cases, this is how people lose toes or feet or parts of legs. Not because diabetes is a death sentence for feet, but because the warning signs were missed. The numbness was ignored, the callus was dismissed, and by the time someone looked closely, the damage was already severe. I am not telling you this to frighten you. I am telling you this because every single one of these outcomes is preventable. Every one. And prevention starts with the simplest possible habit, looking at your feet. Every day. Not once a week, not when they hurt, every single day. Because when you look, you will see the small crack before it becomes a large crack. You will see the redness around a callus that suggests something is happening underneath. You will notice the spot that looks different today than it did yesterday. And that noticing gives you power. It gives you time. It gives you the chance to call your doctor and say, something has changed, before that something becomes an emergency. The sixth warning sign is a change in the shape of your feet. This one surprises people because it seems so mechanical, so structural, so unrelated to blood sugar. But there is a condition called Charcot foot that occurs in people with significant nerve damage from diabetes. The bones in the foot become weakened and brittle. Tiny fractures happen without the person feeling them because of the numbness. And as the person continues to walk on those fractured bones, the architecture of the foot collapses. The arch flattens. The foot becomes wider and shorter. The bottom of the foot develops a rocker bottom shape. This is a serious condition. It requires immediate medical attention. And the only way to catch it early is to notice that your feet look different, that your shoes feel different, that your footprint in the sand or on the bathroom floor does not look the way it used to. The seventh warning sign is something many people actively ignore because it feels good. A cold sensation in your feet. Not the cold of a cold room, but a persistent coldness that feels like your feet are sitting in cool water, even when they are warm to someone else's touch. This can be from the nerve damage we have discussed, where faulty nerves report cold when there is no cold. Or it can be from peripheral artery disease, which often occurs alongside diabetes. Peripheral artery disease is narrowing of the arteries in your legs and feet. Blood flow is reduced, and without adequate blood flow, your feet cannot maintain normal temperature. They become cool or cold. And here is the dangerous combination. If you have both nerve damage and artery disease, you cannot feel the cold properly, and your tissues are not getting enough oxygen. That is a recipe for tissue death, for wounds that will not heal, for infections that spread quickly. The eighth warning sign is swelling, fluid retention in your feet and ankles that does not go away overnight. This can be from many things, including, let me tell you about a patient I want you to imagine. Not a real person, but someone who represents a pattern I have seen so many times that the details almost write themselves. His name is Richard. He is 62 years old. He has worked as a high school history teacher for almost 35 years. He is someone who has always taken reasonably good care of himself, not obsessive about it, not someone who runs marathons or counts every calorie, but reasonable. He gets his annual physical most years. He tries to watch what he eats. He walks the dog every evening. He considers himself a pretty healthy guy for his age. About 2 years ago, Richard started noticing something strange in his feet. It was subtle at first, a slight tingling in his toes when he would lie down to watch the news before bed. He would wiggle his feet, shake them a little, and the feeling would go away. He told himself it was probably just his shoes. He had been wearing the same brand of loafers for years. Maybe they were wearing out. Maybe his feet were just getting older. Everyone says feet get weirder as you age, right? The tingling became more frequent. Then it became a numbness in his big toes that never quite went away. He noticed that when he walked across the living room carpet in bare feet, He could not really feel the texture anymore. It just felt like walking on something soft and indistinct. He mentioned this to his wife one evening. She said maybe he should get new slippers, and that made enough sense to him that he let it go. Then came the crack. Richard developed a small crack in the skin on his right heel. It looked like the kind of dry skin crack that almost everyone gets in the winter. He put lotion on it for a few days. He wore socks to bed. The crack did not heal, but it did not get worse either. It just stayed there. A small, painless line in his heel that he could see when he put his foot up on his knee to clip his toenails. He could see it, but he could not really feel it, and because it did not hurt, he assumed it was fine. 6 months later, Richard went for his annual physical. His regular doctor was on leave, so he saw a younger physician he had never met before. The new doctor asked if anything had changed in the past year. Richard mentioned the tingling in his feet. He mentioned the numbness in his toes. He mentioned the crack in his heel that had been there for months and seemed to be getting a little deeper. He said all of this casually, almost as an afterthought, because he did not think any of it was important. The young doctor asked Richard to take off his shoes and socks. She took a small monofilament, which is basically a piece of thin nylon thread attached to a plastic handle. She touched it to different spots on the bottom of Richard's feet and asked him to say yes every time he felt it. Richard could not feel the monofilament on his heels. He could not feel it on the balls of his feet. He could not feel it on several of his toes. He had no idea that his feet had become so numb. He had adapted so gradually that his brain had simply accepted the new normal. The doctor ordered blood work. Richard's hemoglobin A1C came back at 7.4%. Anything over 6.5% is diagnostic for diabetes. Richard had type 2 diabetes, and based on the nerve damage already present in his feet, he had probably had it for at least 5 years, maybe longer. Here is what happened next. Richard was started on medication to lower his blood sugar. He worked with a diabetes educator to change his eating habits. He started checking his feet every single morning before he put his socks on. And here is the part of this story that I want you to hold on to. Richard did not lose his foot. He did not develop a serious infection. He did not end up in the hospital. Because the young doctor listened. Because Richard mentioned the symptoms even though he did not think they mattered. Because they caught it before the crack in his heel became an ulcer. Before the numbness allowed an injury to go unnoticed. Before the damage became irreversible. Richard is not a hero. He is not someone who did everything right. He ignored his symptoms for years. He explained them away. He told himself comfortable stories about aging and shoes and dry skin. But in the end, he did one thing that made all the difference. He mentioned it. He spoke the symptoms out loud to someone who knew what to listen for. Now I want you to imagine a different story. This one is harder to hear, but it is important. Imagine a woman named Patricia. She is 68. She lives alone. Her children live in another state. She is proud of her independence, and she does not like to bother anyone with her problems. Patricia noticed a callus forming on the bottom of her left foot about a year ago, right on the ball of her foot, just behind her second toe. It was thick and hard, and sometimes it bothered her when she walked, but not enough to stop her from doing anything. She bought some over-the-counter callus pads at the drugstore. She tried to file it down herself. It would get a little better for a while, then come back. Patricia also noticed that her feet felt cold a lot of the time. Even in the summer, she would wear socks around the house because her feet just felt chilly. She assumed her circulation was not as good as it used to be. She had heard that circulation gets worse with age. It seemed logical enough. One evening, Patricia was cooking dinner. She dropped a small pot on her foot. It was not a heavy pot. It did not break the skin immediately, but it caused a small bruise and a tiny break in the skin over that callus. She cleaned it with soap and water, put a bandage on it, and forgot about it. She could not really feel it anyway. The numbness in her foot meant that the injury barely registered. Over the next several days, that tiny break in the skin did not heal. The area around it became red. Then it became warm to the touch. Patricia noticed the redness, but again, she could not really feel much pain. So she assumed it was fine. She kept walking on it. She kept putting pressure on that spot with every step. The skin underneath the callus began to break down. A small sore became a larger sore. The larger sore became an ulcer. By the time Patricia mentioned the sore to her daughter during a weekly phone call, the ulcer had been there for 3 weeks. Her daughter drove down that weekend and took her to an urgent care center. The doctor there took one look at Patricia's foot and sent her to the emergency room. She had a deep infection. The infection had spread to the bone. She was admitted to the hospital. She received intravenous antibiotics, and despite everything the doctors did, the infection had caused too much damage. Patricia ended up having a partial amputation of her left foot. Here is what breaks my heart about Patricia's story. It did not have to happen. None of it had to happen. If someone had told her what to look for, if she had known that a persistent callus in an unusual spot is a warning sign, if she had known that cold feet are not just poor circulation, if she had known that a small injury on a numb foot needs medical attention immediately, if she had known any of these things, she would have called her doctor months earlier. She would have been diagnosed with diabetes before the ulcer ever formed. She would have started treatment. She would have learned to check her feet every day. She would still have her foot. I tell you these 2 stories not to overwhelm you with worst-case scenarios. I tell you them because they represent a fork in the road that every single person over 40 will face. On one side of that fork is the path Richard took, a path of gradual, quiet progression of symptoms that are easy to dismiss, but a path that can be redirected if you know what you are looking at. On the other side of that fork is the path Patricia took, a path of the same gradual symptoms, but without the knowledge to interpret them, without the habit of looking, without the awareness that a small change in a foot can be the most important signal your body will ever send you. Here is what I want you to take from these examples. The difference between Richard and Patricia was not their genetics. It was not their access to healthcare. It was not even the severity of their diabetes. The difference was awareness. Richard mentioned his symptoms to a doctor. Patricia did not. Richard learned to look at his feet every day. Patricia did not. Richard understood that a crack in his heel that would not heal was worth investigating. Patricia thought a callus was just a callus. And this is why I am so passionate about teaching people to understand their feet, because feet are honest. They do not lie. They do not minimize. They do not make excuses. They simply reflect what is happening inside your body. And if you learn to read them, you gain access to information that most people never receive. Information that can save your feet. Information that can save your legs. Information that can save your life. Let me give you a specific example of how this plays out in a real primary care practice. A patient comes in for a routine physical. She is 55 years old. She feels fine. She has no complaints. She is only there because her insurance requires an annual visit. I ask her to take off her shoes and socks. I look at her feet. I see that the skin is very dry. I see that she has thick calluses on the balls of both feet. I see that her heels are cracked. I take out my monofilament and test her sensation. She cannot feel the filament on several spots on her left foot. She is surprised. She tells me she had no idea. She thought her feet were normal. I order blood work. Her hemoglobin A1C is 6.9%. She has diabetes. She has had it for years, but she had no symptoms that she recognized as symptoms. No thirst, no frequent urination, no fatigue, just her feet. Quietly, patiently, telling the truth about her metabolic health. And because I looked, and because I tested, and because she was willing to take off her shoes, we caught it before any serious damage was done. Before the cracks became ulcers. Before the numbness led to an injury she could not feel. Before the calluses broke down. That patient started medication. She changed her diet. She started walking 30 minutes a day. She bought a small hand mirror to check the bottoms of her feet every morning. 6 months later, her Her A1C was down to 6.2%. Her feet had not healed completely, but they were better. The cracks were smaller, the calluses were less thick. She had sensation in places where she had been numb. Her body was responding, because she knew. So here is my question for you, and I want you to really sit with this. Now I want to take you inside your body, not with complicated medical diagrams or overwhelming terminology, but with a clear, step-by-step understanding of what actually happens when blood sugar rises. Because once you see the mechanism, the warning signs in your feet will no longer seem random. They will fit together like pieces of a puzzle, and you will understand, perhaps for the first time, why your feet are the canary in the coal mine for your metabolic health. Let us start with something simple: glucose. Glucose is sugar, but more importantly, glucose is fuel. Every cell in your body uses glucose for energy. Your brain uses glucose. Your muscles use glucose. Your heart uses glucose. Your nerves use glucose. Without glucose, you would not survive a single day. So glucose is not the enemy. The problem is not glucose itself. The problem is too much glucose in your blood for too long. Think of your bloodstream as a highway. Glucose molecules are cars. Insulin is the traffic controller. When you eat food, especially carbohydrates, glucose enters your bloodstream. Your pancreas releases insulin. Insulin tells your cells to open their doors and let glucose in. Your cells take the glucose, use it for energy, and your blood sugar levels return to normal. This is how a healthy body works. This is how your body has worked for most of your life. But here is where things start to change. Over years of eating patterns, activity levels, weight changes, and genetic predisposition, your cells can become resistant to insulin. They stop listening to the signal. Insulin knocks on the door, but your cells do not open it. Your pancreas responds by making more insulin. It tries harder. It shouts louder. For a while, this works. Your blood sugar stays normal because your pancreas is working overtime. But eventually, your pancreas gets tired. It cannot keep up with the demand. And now, when you eat, glucose enters your bloodstream, but your cells will not let it in. The glucose stays in your blood. Your blood sugar rises, and it stays high. This is type 2 diabetes. Not a sudden event, not a switch that flips overnight, a gradual process that takes years, sometimes 5 years, sometimes 10 years, sometimes 15 years. And during all of those years, while your blood sugar is slowly climbing, damage is being done. Silent damage. Damage you cannot feel. Damage that happens in the smallest blood vessels in your body. This brings us to the first critical mechanism. High blood sugar damages blood vessels. Specifically, it damages the endothelium, which is the delicate inner lining of your blood vessels. When your blood sugar is high, glucose molecules attach themselves to proteins in your blood vessel walls. This process is called glycation. It creates something called advanced glycation end products. The acronym is AGEs, which is almost too perfect, because these molecules accelerate aging in your blood vessels. They make your blood vessels stiff, they make them narrow, they make them leaky, they make them less able to deliver oxygen and nutrients to your tissues. Now think about your feet for a moment. Your feet are the farthest point from your heart. The blood vessels that supply your feet are long and narrow. They are the smallest pipes in your plumbing system. They are the first places where blood flow becomes compromised when those vessels become stiff and damaged. This is why people with diabetes develop peripheral artery disease. The arteries in their legs and feet narrow. Blood flow decreases. Their feet become cold. Their feet become pale. Their feet become vulnerable to injury because the healing process requires blood flow, and the blood flow is no longer adequate. But blood vessel damage is only half of the story. The other half is nerve damage, and this is where the warning signs become truly specific. High blood sugar damages nerves through several mechanisms. First, the same glycation process that damages blood vessels also damages the myelin sheath that surrounds your nerves. Myelin is like the insulation on an electrical wire. When it is damaged, the nerve signals become slow and distorted. Second, The small blood vessels that feed your nerves become damaged, just like the larger vessels. Your nerves are starved of oxygen and nutrients. Third, high blood sugar causes oxidative stress, which is basically a form of chemical damage inside your nerve cells. The cells become inflamed, they begin to malfunction, and eventually, they begin to die. Here's the part that explains everything we have discussed about the 9 warning signs. The longest nerves in your body are the ones that run from your spinal cord all the way down to your toes. They are called peripheral nerves, and because they are so long, they are the most vulnerable to damage. They have the longest distance to receive oxygen and nutrients. They have the most surface area exposed to high blood sugar. They are the first to show signs of trouble. This is called diabetic peripheral neuropathy, and it is the reason why your feet feel the effects of high blood sugar before almost any other part of your body. Let me walk you through exactly how this nerve damage creates the specific warning signs we discussed. The tingling sensation, the pins and needles, comes from nerves that are irritated but not yet destroyed. They are sending faulty signals to your brain. Your brain interprets those faulty signals as tingling or prickling. The numbness comes from nerves that have progressed past irritation to actual dysfunction. They are no longer sending signals at all. The burning sensation comes from nerves that are sending pain signals inappropriately. The damaged nerves misinterpret normal sensations as pain or heat. This is why your feet can feel like they are burning when they are perfectly cool to the touch. Now let me add another layer that most people do not know. High blood sugar also damages the autonomic nerves. These are the nerves that control things you do not think about, like sweating and blood flow. When autonomic nerves are damaged, your feet stop sweating normally. Your skin becomes dry. Dry skin cracks. Cracked skin creates openings for infection. And because the sensory nerves are also damaged, you cannot feel those cracks forming. You cannot feel the early signs of infection. You are walking around with an open wound and you do not even know it. This is the mechanism behind the slow healing we discussed. 3 things are happening at once. First, your blood vessels are damaged, so oxygen and healing cells cannot reach the wound. Second, your nerves are damaged, so you do not feel the wound and you do not protect it. Third, high blood sugar itself impairs your immune system. White blood cells do not function as well in a high sugar environment. Bacteria love sugar. They grow faster in high blood sugar. So you have a wound that cannot heal, that you cannot feel, that you are walking on constantly, in an environment where bacteria thrive. This is why foot ulcers in people with diabetes are so dangerous. This is why they can go from a small crack to a deep infection in a matter of weeks. Let me give you a timeline so you can understand how slowly this damage accumulates and how early you can intervene. In the first year of elevated blood sugar, the changes are microscopic. Your blood vessels begin to stiffen. Your nerves begin to show signs of oxidative stress, but you feel nothing. In year 2, you might notice occasional tingling in your toes after a long day. You dismiss it. In year 3, your skin becomes drier than it used to be. You buy more lotion. In year 4, you develop a callus in a spot where you never had one before. You assume your shoes are changing your gait. In year 5, you notice that small cuts take a few extra days to heal. You do not think much of it. In year 6, the numbness begins. Not total numbness, but a dulling of sensation. You stop feeling the texture of your carpet. You stop noticing when your socks are bunched up. In year 7, you develop a crack in your heel that does not go away. You try lotion. You try a pumice stone. Nothing works. In year 8, you develop an ulcer. You do not feel it forming. You only notice it when you see blood on your sock. In year 9, you see a doctor. The infection has already spread. The outcome is uncertain. Here is what I want you to see in that timeline. Every single year from year 1 through year 7, intervention would have made a difference. Every single year. If you had checked your blood sugar in year 2 when you first noticed tingling, you could have started lifestyle changes and prevented all the damage that came after. If you had seen a doctor in year 4 when you noticed that unusual callus, You could have been diagnosed early and protected your nerves from further harm. If you had mentioned the slow healing in year 5, you could have started medication before the numbness ever set in. The window of opportunity is not small. It is years wide, but it closes. And it closes faster than you think once the numbness and the ulcers begin. Now let me address something that might be troubling you. You might be thinking, I have some of these symptoms. Does this mean I definitely have diabetes? No, it does not. There are many causes of foot tingling, foot numbness, dry skin, and slow healing. Vitamin deficiencies, thyroid disorders, alcohol use, certain medications, autoimmune conditions, even simply getting older can cause some degree of nerve changes. But here's what I want you to understand. If you have these symptoms, they deserve an explanation. They deserve to be investigated. And the most common explanation in adults over 40 with the symptoms we have discussed is elevated blood sugar. Not the only explanation, but the most common one, and the one that is easiest to test for. A hemoglobin A1C test costs very little. It takes one small tube of blood. It gives you a 3-month average of your blood sugar levels. There is no fasting required. There is no preparation needed. You can get one tomorrow. And if your A1C comes back normal, you have ruled out the most common cause of your symptoms. You can move on to investigate other possibilities. But if your A1C comes back elevated, you have caught something early. You have caught it before it caused irreversible damage to your nerves and blood vessels. You have caught it at a time when lifestyle changes and medication can make a real difference. You have caught it before the ulcers, before the infections, before the amputations. This is why I am so direct about these warning signs. Not because I want to scare you, but because I want to give you the information that most people never receive until it is too late. Your feet are not just feet. They are early warning sensors. They are biological instruments that measure the health of your smallest blood vessels and your longest nerves. And they are speaking to you right now. The question is whether you are listening. In the next part of our conversation, I am going to give you 3 key insights that most people miss. Now I want to share with you 3 key insights that most people miss. Not because they are hidden or complicated, but because no one has ever laid them out this clearly before. These insights will change how you see your feet, how you understand your body, and how you approach your health from this day forward. Each insight builds on the one before it, so take your time with them. Let them settle in. The first insight is this. Your feet do not warn you about diabetes in the way you expect. They do not send dramatic signals. They do not cause sharp pain that demands your attention. They do not turn colors or swell dramatically in most cases. Instead, they send quiet signals. Signals that are easy to dismiss because they feel like normal aging. And that is exactly why so many people miss them. Think about the difference between chest pain and foot numbness. Chest pain is alarming. Your brain immediately recognizes chest pain as a potential emergency. You call your doctor. You go to the emergency room. You get tests. You get treatment. Foot numbness is not alarming. It does not hurt. It does not stop you from doing anything. It just sits there in the background, a quiet absence of sensation that your brain quickly adapts to. You stop noticing that you cannot feel your carpet. You stop noticing that your socks feel different. You stop noticing that the floor seems farther away than it used to. Your brain recalibrates what normal feels like. And by the time you actually notice that something is wrong, the nerve damage has been progressing for years. Here's what this means for you. You cannot rely on your feet to alert you with dramatic symptoms. They will not scream. They will whisper. And you have to train yourself to listen to the whisper. That means paying attention to small changes. The slight tingling after dinner. The spot on your heel that feels different from the other heel. The way your shoes feel a little looser or a little tighter than they used to. The small cut that took an extra day to heal. These are not nothing. These are whispers. And every time you dismiss a whisper, you lose an opportunity to intervene early. Let me give you a practical example of how this works. 2 people notice that their feet feel cold at night. The first person says, "My feet are always cold. It is probably just my circulation. Everyone my age has cold feet, and they do nothing. The second person says, my feet are cold at night, and I do not remember them being cold a year ago. I wonder what changed. That second person mentions it to their doctor. The doctor checks their A1C. It is elevated. They catch it early. The first person does not catch it until years later, when the numbness has progressed and a small injury becomes a serious problem. Same symptom, same body, same age, different outcome. The only difference was paying attention to the whisper. So the first insight is simple but profound. Foot symptoms of diabetes are quiet, not loud. They feel like aging, not disease, and you have to actively choose to notice them. No one will notice them for you. Not your spouse, not your children, not your doctor at your annual physical unless you mention something. The responsibility is yours, and that is not a burden, it is a gift, because it means you have the power to catch this early. You do not need expensive tests or advanced technology. You just need awareness and a small habit of paying attention to your feet. Now let me give you the second insight, and this one surprises almost everyone. The damage to your feet from high blood sugar is not reversible, but it is almost always preventable. Let me say that again because it is the most important sentence in this entire conversation. The damage is not reversible, but it is almost always preventable. Here is what I mean. Once a nerve is destroyed, it does not grow back. Once a blood vessel is severely damaged, it does not become healthy again. The medical treatments for diabetic neuropathy focus on managing symptoms and preventing progression. They do not reverse the damage that has already been done. If you have significant numbness in your feet today, you will likely have some degree of numbness for the rest of your life. That is the honest truth. And I tell you this not to discourage you, but to motivate you. Because while the damage that has already happened cannot be reversed, the damage that has not happened yet can be prevented. Completely. And that is where your power lies. Think about it this way. Every day that your blood sugar is normal, your nerves are safe. Every day that your blood sugar is well controlled, your blood vessels are protected. The damage does not happen all at once. It happens slowly, over years, one small injury at a time. And every day that you keep your blood sugar in a healthy range, you are preventing those small injuries. You are protecting the nerves you still have. You are preserving the sensation you still feel. You are giving your feet the best possible chance to stay healthy for the rest of your life. This is why early detection is so critical. If you catch elevated blood sugar before significant nerve damage has occurred, you can prevent almost all of the foot complications that people fear. You can keep your sensation. You can keep your blood flow. You can keep your feet. But if you wait until the numbness is severe, if you wait until the ulcers have formed, you have missed the window for prevention. You are now in the realm of damage control. And damage control is always harder, more expensive, and less successful than prevention. Let me give you a number that should stick with you. Studies show that people with diabetes who perform a daily foot check and see a foot specialist regularly reduce their risk of amputation by more than 80%. 80%. That is not a small improvement. That is a transformation. And it comes from something as simple as looking at your feet every day and getting routine professional care. Not from expensive medications or complicated procedures, from awareness and prevention. So the second insight is this. You cannot go back and undo the damage that has already happened, but you can stop it from getting worse. And stopping it from getting worse is almost as good as preventing it in the first place. Because every day that you protect your remaining nerve function is a day that you keep your feet healthier than they would have been otherwise. Do not let perfect be the enemy of good. Do not say, well, I already have some numbness, so there is nothing I can do. That is false. There is everything you can do. You can stop the progression. You can preserve what you have. You can prevent the next stage of damage. And that is a victory worth pursuing. Now let me give you the third insight. And this one is the most practical and the most powerful. The single best predictor of foot complications is not your blood sugar level today. It is whether you look at your feet every day. Let me explain what I mean by that. Your blood sugar level is important. Of course it is. Keeping your A1C below 7% reduces your risk of neuropathy significantly. But here is what the research shows. People with well-controlled blood sugar who do not look at their feet have more foot complications than people with poorly controlled blood sugar who look at their feet every day. That sounds counterintuitive, but it makes perfect sense when you think about it. Looking at your feet every day is not about measuring your blood sugar. It is about catching problems early. A small crack that you see today can be treated with lotion and a bandage. That same crack, if you do not see it for a week, can become infected. A small blister that you notice today can be protected and kept clean. That same blister, if you do not notice it for 3 days, can become an ulcer. A spot of redness around a callus that you see today can be evaluated by your doctor. That same redness, if you miss it for a week, can be a deep infection. The difference between a minor issue and a major complication is often just a few days. And those few days are bridged by one simple habit: looking at your feet. Let me tell you exactly how to do this. It takes less than 2 minutes. Every morning, before you put your socks on, sit down in a well-lit room. Put your foot up on your opposite knee. Look at the top of your foot. Look at the bottom of your foot. If you cannot see the bottom clearly, use a small hand mirror or put your phone on video and point it at the sole of your foot. Look for any changes: cuts, blisters, redness, swelling, calluses, cracks, changes in skin color. Look between your toes. Fungal infections often start there. Look at your nails. Thickened or discolored nails can be a sign of fungal infection or poor circulation. Run your hands over your feet. Feel for warmth. Compare one foot to the other. They should feel the same temperature. They should look the same color. Any difference is worth noting. This habit does not require medical training. It does not require special equipment. It requires only consistency and attention. And it is the single most effective way to prevent serious foot complications from diabetes. Not medication, not expensive shoes, not frequent doctor visits. Looking at your feet every single day. Now let me add one more layer to this insight. Looking at your feet is not just about finding problems. It is about building a relationship with your body. When you look at your feet every day, you establish a baseline. You learn what normal looks like for you. You learn what your calluses usually look like. You learn what color your feet normally are. You learn how your skin usually feels. And because you have that baseline, you will notice when something changes. The change is the signal. The change is what matters. And you will only notice the change if you have established the baseline. Most people never establish a baseline. They only look at their feet when something hurts. And by the time something hurts, the problem has often been developing for weeks or months. That is too late for the simple interventions. That is when you need antibiotics or surgery or hospitalization. Looking at your feet every day shifts you from reactive to proactive. It moves you from waiting for pain to watching for change. And that shift is everything. So let me bring these 3 insights together. First, the symptoms are quiet. They whisper. You have to choose to listen. Second, the damage is not reversible, but it is preventable. Every day that you protect your nerves is a victory. Third, the best predictor of foot complications is whether you look at your feet every day. That simple habit is your most powerful tool. Here's what I want you to do with these insights. I want you to stop thinking about your feet as something that only matters when they hurt. I want you to start thinking about your feet as something that matters every single day. I want you to build the 2-minute habit of looking at your feet every morning. And I want you to share this information with the people you love. Tell your spouse. Tell your parents. Tell your friends over 40. Tell them that their feet are talking to them. And teach them how to listen. In the final part of our conversation, let us take a breath together. We have covered a lot of ground. We have talked about 9 specific warning signs. We have walked through the stories of Richard and Patricia. We have gone inside the body to understand how high blood sugar damages nerves and blood vessels. We have uncovered 3 key insights that most people never learn. And now it is time to bring everything together into a calm, clear, practical understanding that you can carry with you. Here's what I want you to take away from this entire conversation. Not fear, not anxiety, not the sense that something terrible is lurking in your body waiting to harm you. The opposite of that. I want you to take away clarity. I want you to take away awareness. I want you to take away a simple, actionable framework for paying attention to your health in a way that most people never learn. Your feet are not complicated. They are not mysterious. They are not beyond your ability to understand. Your feet are honest messengers. They tell you the truth about your metabolic health. And the truth is not something to be afraid of. The truth is something to work with. The truth is something that gives you power. Because once you know the truth, you can do something about it. So let me give you a calm reflection on what all of this means for your life, starting today. First, understand that your body is always communicating with you. Every sensation, every change, every small difference between how you feel today and how you felt last year is a piece of data. Most people ignore most of this data, not because they are careless, but because no one ever taught them that the data matters. No one ever told them that the slight tingling in their toes is not just aging. No one ever explained that the dry skin on their heels is not just winter. No one ever said that the small cut that took a week to heal is worth mentioning to a doctor. Now you know. And knowing changes everything. You do not need to become obsessed with your health. You do not need to check your feet 10 times a day or worry about every small sensation. That is not the goal. The goal is awareness without anxiety. The goal is to establish simple habits that take almost no time but provide enormous benefit. The goal is to move through your life with a quiet confidence that you are paying attention to the signals that matter. Second, recognize that early detection is the single most powerful tool you have. Not just for diabetes, for almost every chronic disease. The earlier you catch something, the more options you have. The earlier you catch something, the less damage has been done. The earlier you catch something, the easier it is to treat. This is not controversial. This is not complicated. This is simply how medicine works. And your feet are one of the earliest warning systems your body has for metabolic problems. Think about the alternative. Think about waiting until you have symptoms that are impossible to ignore. Thirst so intense you wake up multiple times every night to drink water. Urination so frequent you cannot go more than an hour without finding a bathroom. Vision so blurry you cannot read or drive safely. Fatigue so profound you can barely get through your day. These are the classic symptoms of diabetes, and they usually appear only after blood sugar has been dangerously high for a long time. By the time you have those symptoms, the damage to your nerves and blood vessels is already significant. You have missed the window for prevention. You are now in the window for damage control. But if you catch it early, when the only signs are the quiet whispers in your feet, you have options. You can change your eating habits. You can increase your physical activity. You can lose a modest amount of weight. You can take medication if needed. And you can bring your blood sugar back into a healthy range before significant nerve damage occurs. You can keep your sensation. You can keep your blood flow. You can keep your feet healthy for the rest of your life. That is what early detection buys you. That is why the quiet whispers matter. Third, I want you to reframe how you think about your annual physical. Many people see their yearly checkup as a chore, something to get through, something that probably will not find anything anyway. But I want you to see it differently. I want you to see your annual physical as an opportunity to check in with your body, an opportunity to mention the small changes you have noticed, an opportunity to ask for the tests that matter. When you go to your doctor, take off your shoes and socks without being asked. Show your doctor your feet. Say, I have been paying attention to my feet and here is what I have noticed. Mention the tingling. Mention the numbness. Mention the dry skin. Mention the calluses. Mention the slow healing. Mention anything that has changed. Your doctor cannot read your mind. Your doctor does not know what you have been feeling unless you say it out loud. And your doctor will take you more seriously when you come in with specific observations rather than vague complaints. Ask for a hemoglobin A1C test, not just a fasting blood sugar. Fasting blood sugar tells you what your blood sugar is at one moment in time. The A1C tells you your average blood sugar over the past 3 months. It is a much better measure of your overall metabolic health. It is the test that catches diabetes early, when fasting blood sugar is still normal. And it is a test that every adult over 40 should have at least once a year, especially if you have any of the warning signs we have discussed. Fourth, I want you to build the 2-minute habit. Every morning, before you put your socks on, look at your feet. Really look. Use a mirror if you need to. Check between your toes. Check the bottoms of your feet. Check your heels. Look for anything new, anything different, anything that was not there yesterday or last week. This is not about becoming anxious. This is about becoming observant. This is about building a relationship with your body that serves you for the rest of your life. If you find something concerning, do not panic. Most findings are not emergencies. A small crack can be treated with moisturizer. A small blister can be covered with a bandage. A callus can be monitored. But if you find something that does not heal within a few days, or something that looks infected, or something that you are simply unsure about, call your doctor. Send a picture through your patient portal if that is an option. Get an opinion. It is always better to ask and be told it is nothing than to wait and find out it is something. Fifth, I want you to think about the people you love. The information I have shared with you today is not just for you. It is for your spouse. It is for your parents. It is for your siblings. It is for your friends who are over 40 and who have never been told that their feet are trying to tell them something important. Share this conversation with them, not as a warning, not as something to be afraid of, but as a gift, a piece of knowledge that could save their feet, that could save their mobility, that could save their independence. So many people develop serious foot complications from diabetes simply because no one ever told them what to look for. They never knew that the numbness was important. They never knew that the crack in their heel needed attention. They never knew that a daily foot check could prevent an amputation. You know now. And knowing carries a responsibility to share, not with fear, with compassion, with the simple desire to help the people you care about age well and stay healthy. Finally, I want to leave you with a sense of calm confidence. Not because diabetes is not serious, it is. Not because foot complications cannot happen to you, they can. But because you now have information that most people never receive. You now have a framework for paying attention that most people never develop. You now have the power to catch problems early, to prevent damage, and to keep your feet healthy for the rest of your life. That is not fear, that is empowerment. Your feet have been talking to you every single day. They have been sending you messages about your blood sugar, your nerves, your blood vessels, your metabolic health. And now you know how to listen. You know what to look for. You know when to mention something to your doctor. You know how to protect yourself. So here is my final question for you. Not a question I expect you to answer out loud, but a question I want you to carry with you. A question that will guide you toward better health, better awareness, and better aging. What are your feet telling you today? Take off your shoes. Look at your feet. Really look. And then decide what comes next. Maybe it is nothing. Maybe everything looks fine. That is wonderful. Keep looking. Keep paying attention. Keep the habit alive. Or maybe you notice something you had not noticed before. Something that has been there for a while that you had dismissed. Something that deserves a conversation with your doctor. That is not bad news. That is useful information. That is data you can act on. That is the beginning of prevention. You are not a victim of your body. You are a partner with your body. Your body sends signals. You learn to read them. You respond appropriately. That is the dance of health. That is the practice of aging well. And it starts with your feet. Thank you for spending this time with me. Thank you for being willing to learn something new about your body. Thank you for caring enough about your health to listen to a quiet, thoughtful conversation about feet and blood sugar and prevention. That curiosity, that willingness to learn, is the most powerful tool you have. more powerful than any medication, more powerful than any test, more powerful than any doctor, because it lives inside you, and it will serve you every day for the rest of your life. This is Dr. Narges from HealthWise. Take care of your feet, listen to what they are telling you, and I will see you in the next conversation.